Important. Millions in the United States struggle with blood sugar imbalances daily, and diabetes is now considered one of the most dangerous silent killers of our time. The rise of type 2 diabetes is alarming in the United States, Canada, the United Kingdom, and Australia. If you have high blood sugar or prediabetes, the right supplements may change your life, but only if you understand how they work and use them correctly. One of the most powerful and well-researched supplements for lowering blood sugar is berberine, found naturally in plants like golden seal, barberry, and Oregon grape. Berberine works on a cellular level to activate an enzyme called AMPK, often referred to as a metabolic master switch. This enzyme plays a critical role in regulating how your body uses sugar. Many clinical studies have shown that berberine can reduce fasting blood glucose, improve insulin sensitivity, and even lower A1C levels. In fact, some researchers have found that berberine works nearly as effectively as metformin, a commonly prescribed medication in the United States for managing type 2 diabetes. What's shocking is that despite the data, most physicians in the United States don't recommend it unless the patient brings it up. Why is that? Because in many cases, the focus is still on medication rather than metabolic repair. Berberine may also improve gut health, which is deeply linked to insulin resistance and inflammation. If you're struggling with belly fat, fatigue after meals, constant sugar cravings, or even darkened skin patches, signs of insulin resistance, berberine should be considered a priority supplement, but it must be taken consistently, usually 500 milligrams 2 to 3 times daily with meals to have a real effect. Another supplement with deeply studied blood sugar benefits is Ceylon Cinnamon. This is not the cheap cassia cinnamon most people in the United States are used to sprinkling on toast. Ceylon cinnamon, often called true cinnamon, contains unique compounds like cinnamaldehyde that influence insulin receptors directly and enhance glucose uptake by cells. Studies out of Canada and the United Kingdom have shown that 1 to 6 grams of Ceylon cinnamon daily can reduce fasting blood sugar by up to 29%. What's important to understand is that regular cassia cinnamon can actually be toxic in large doses, due to a compound called coumarin, which may harm the liver over time. But Ceylon cinnamon is much safer, making it a better long-term option. The way it stabilizes post-meal blood sugar makes it extremely helpful for people who experience energy crashes or feel drowsy after eating, a common problem for Americans on high-carb diets. If you're the kind of person who needs a nap after lunch or feels wired and then crashes after sugar, your insulin sensitivity is likely impaired, and this is where cinnamon shines. In the United States, it's often used as a natural add-on but rarely appreciated for its medicinal potency. Alpha-Lipoic Acid, ALA, is another potent compound, especially valued in diabetes care across Canada and Germany. It's a powerful antioxidant that helps reduce oxidative stress, which is a major driver of insulin resistance and diabetic complications, especially neuropathy. Alpha-lipoic acid is unique because it's both fat and water-soluble, meaning it can travel virtually anywhere in the body and repair damage. People with diabetes often suffer from nerve damage, burning feet, tingling, numbness, and ALA has been shown to significantly reduce these symptoms, particularly when taken in doses between 600 to 1,200 mg per day. It also helps regenerate. Other antioxidants like glutathione, which are often depleted in individuals with chronically high blood sugar. If you live in the United States and have diabetes, your nerves are under constant attack from elevated glucose levels, and ALA is one of the few compounds that can intervene. It also enhances the uptake of glucose into muscles, further lowering blood sugar without causing dangerous crashes. Next on the list is magnesium, which is involved in over 300 biochemical reactions in the body and plays a central role in insulin signaling and glucose metabolism. In the United States, it's estimated that over 50% of adults are magnesium deficient, mostly due to poor soil quality and highly processed diets. Low magnesium levels are strongly associated with insulin resistance, higher fasting glucose, and even an increased risk of developing diabetes. Supplementing with magnesium, especially magnesium glycinate or magnesium citrate, can dramatically improve insulin sensitivity. Studies have found that people with higher magnesium intake have a 15% to 26% lower risk of developing type 2 diabetes. What's particularly painful is how many Americans go undiagnosed for magnesium deficiency even when they have clear signs: leg cramps, irritability, muscle twitches, and poor sleep. Magnesium can also help reduce cortisol, the stress hormone, that contributes to glucose dumping into the bloodstream. If your stress is high, your sleep is poor, and your blood sugar is stubbornly elevated, magnesium may be the missing piece. It should be taken at night for best effect, and in the range of 200 to 400 mg. Chromium Picolinate is another mineral that has been studied for decades in relation to blood sugar. It enhances the action of insulin, helping it do its job more effectively, and may reduce insulin resistance over time. Chromium supplementation in the United States became popular in the 1990s, but many people took the wrong form or wrong dose. The most effective form is Chromium Picolinate, not just generic chromium. In doses between 200 to 1,000 mcg per day, chromium can help reduce fasting blood glucose, improve A1C, and even curb sugar cravings. This is extremely important for people who feel like they're addicted to sugar, a common situation in American dietary culture. Refined carbs, soda, sweetened coffee, and desserts flood the system with glucose, and the pancreas gets overworked. Chromium may help regulate the dopamine response triggered by sugar and support more balanced eating habits. If you constantly feel like you need something sweet after meals, your blood sugar rhythm is likely broken, and chromium might help you fix it. Fenugreek seeds, widely used in Indian cooking but underappreciated in American healthcare, are packed with soluble fiber that slows the absorption of sugars in the intestines. Several studies in the United Kingdom and India have shown that taking 5 to 25 grams of fenugreek daily can significantly lower fasting glucose and postprandial sugar spikes. The key compound in fenugreek is 4-hydroxyisoleucine, which increases insulin sensitivity and improves the body's natural glucose response. What's remarkable is that even people with long-standing type 2 diabetes have shown improvements in their blood sugar numbers with fenugreek supplementation. For people in the United States dealing with stubborn post-meal spikes despite medications, fenugreek may offer a natural alternative with fewer side effects. It can be taken in capsule form or as ground seed, and works best when taken with meals. One of the challenges is its taste and smell, which some Americans find unpleasant, but the benefits often outweigh the inconvenience. Another supplement gaining popularity, especially in functional medicine circles in the United States and Canada, is inositol, particularly myo-inositol and D-chiroinositol. These are vitamin-like substances that improve insulin signaling at the cellular level and are especially useful for women with PCOS, polycystic ovary syndrome, a condition strongly linked to insulin resistance. Inositol has been shown to restore ovulation, reduce testosterone levels, and normalize blood sugar in women struggling with both reproductive and metabolic issues. What's surprising is that many endocrinologists in the United States still don't recommend it, even though studies clearly show that 2 grams of myo-inositol taken twice daily can have effects comparable to metformin, without the gastrointestinal side effects. It works by improving insulin receptor sensitivity and supporting healthy neurotransmitter function, which means it can also improve mood and reduce cravings. This makes it particularly beneficial for people who eat in response to stress or emotional triggers. In a country like the United States, where stress eating is incredibly common, inositol offers a powerful tool to interrupt that cycle and improve both mental and metabolic health. Gymnema sylvester, often called the sugar destroyer, is another herb that has shown incredible promise in clinical trials, especially in patients with poorly managed blood sugar. Native to India, but now increasingly available in supplement form across Australia, Canada, and the United States, gymnema contains compounds called gymnemic acids that bind to sugar receptors in the intestines and on the tongue, literally reducing the sweetness perception and blocking sugar absorption. Some people even report that after taking gymnema, sugar tastes bland or flat. But beyond this, gymnema has been shown to regenerate insulin-producing beta cells in the pancreas and reduce sugar cravings dramatically. Doses of 400 to 600 milligrams daily have been used in studies showing significant improvements in blood glucose levels and even weight loss in overweight individuals with insulin resistance. For people in the United States who feel trapped in the cycle of high-carb eating and constant snacking, gymnema can help break that habit by dulling the reward response to sweet foods. One of the most overlooked but incredibly powerful supplements for diabetes health is resveratrol. Found naturally in the skin of red grapes and some berries, resveratrol has gained a lot of attention for its anti-aging and heart-protective benefits. But what most people in the United States don't know is that it also plays a critical role in glucose metabolism. It activates the SIRT1 gene, which helps improve mitochondrial function, reduce inflammation, and increase insulin sensitivity. In a randomized controlled trial, patients with type 2 diabetes who took resveratrol saw a significant decrease in fasting glucose, HbA1c, and even body weight. Resveratrol also helps reduce oxidative stress in the pancreas, which is one of the reasons why insulin production declines over time. It's especially useful for people with metabolic syndrome, prediabetes, or early-stage type 2 diabetes. In the United States, where the standard diet and sedentary lifestyle are accelerating insulin resistance, resveratrol offers a natural, non-pharmaceutical way to fight back. Most studies have used doses between 100 to 500 milliliters daily, and the effects tend to build over time. If you experience blood sugar highs even with dietary changes, adding resveratrol might give you the edge you need. Bitter melon, also known as bitter gourd, is a plant-based remedy that's been used for centuries in Asia, but only recently recognized in North America, especially among alternative health practitioners in Canada and the United States. Bitter melon contains bioactive compounds like charantin and polypeptide P that act like insulin in the body. These compounds help transport glucose into cells and improve how sugar is used, particularly in muscle tissue. Clinical trials have shown that bitter melon extract can lower both fasting and post-meal blood sugar levels. One of the biggest advantages is that it works on multiple pathways. It enhances glucose uptake, increases insulin sensitivity, and even inhibits enzymes that break down carbohydrates. In the United States, where high-carb eating habits dominate the culture, think fast food, pasta, bread, sugary drinks, bitter melon can be incredibly useful in preventing the rapid spikes that lead to inflammation and fat storage. But people often avoid it due to the strong, bitter taste. Capsules or tinctures are a better choice for most, and doses between 1,000 to 2,000 mg per day have been shown to be effective. Vitamin D is something most people associate with bone health, but it has a far more important role in diabetes management than most realize. Vitamin D influences insulin secretion and sensitivity, and deficiency is shockingly common in the United States, United Kingdom, Canada, and even Australia, despite access to supplements and fortified foods. Research has shown that people with low vitamin D levels are at a significantly higher risk of developing type 2 diabetes, and that supplementing with vitamin D3 can improve blood sugar control, especially in those who are already deficient. The pancreas has vitamin D receptors, and when these receptors don't get enough stimulation, insulin release becomes impaired. In the United States, it's very common to see people with blood levels below 30 ng/ml, which is considered deficient. Ideal blood levels for insulin sensitivity and metabolic health are between 50 to 80 ng/ml. Daily doses between 2,000 to 5,000 IU are often needed, especially in the winter months. If you're struggling with stubborn belly fat, poor immune function, and worsening glucose control, vitamin D status should be checked and optimized immediately. Another strong candidate for blood sugar support is zinc, a mineral essential for proper insulin function, antioxidant defense, and inflammation control. Zinc plays a crucial role in the synthesis and storage of insulin in the pancreas, and it helps reduce markers of oxidative damage that are elevated in people with diabetes. In the United States, zinc deficiency is not rare, especially in people consuming high amounts of processed foods that are low in nutrients. Supplementation with zinc has been shown to reduce fasting glucose, improve insulin sensitivity, and even support better immune response, which is especially important because people with diabetes are more vulnerable to infections. Zinc picolinate and zinc citrate are better absorbed forms, and most effective doses range between 15 to 45 milligrams daily. But long-term high-dose zinc use should be balanced with copper intake, as it can cause deficiencies over time. People who frequently get colds, have poor wound healing, or experience loss of taste or smell may be deficient and should consider zinc supplementation immediately. Blood sugar is only one aspect of the damage caused by zinc deficiency. Immune dysfunction and hormonal disruption are also deeply tied in. CoQ10, coenzyme Q10, is often used for heart health in the United States, especially by people on statin medications, but its effects on blood sugar are often underappreciated. CoQ10 is a powerful antioxidant and essential part of the mitochondria, the cell's energy factories. In people with diabetes, mitochondrial dysfunction is common, leading to poor energy production and increased fatigue. CoQ10 improves mitochondrial efficiency, reduces oxidative stress, and helps cells respond better to insulin. Studies show that people with diabetes who supplement with CoQ10 experience lower fasting glucose, reduced A1C, and better overall energy levels. This is crucial because fatigue is one of the most common and frustrating symptoms reported by Americans with high blood sugar. The standard diet and sedentary lifestyle destroy mitochondrial health, and CoQ10 helps restore it. Ubiquinol is the more bioavailable form, and doses between 100 to 300 milligrams per day are effective. It's especially important for people over 40, as natural CoQ10 production declines with age, making supplementation more critical. Finally, turmeric. With curcumin deserves a place on this list due to its extensive anti-inflammatory and blood sugar stabilizing effects. Turmeric root, a common ingredient in Indian cooking, contains curcumin, a compound that reduces inflammation, boosts antioxidant capacity, and improves insulin sensitivity. Chronic inflammation is a silent driver of insulin resistance, and people in the United States are constantly bombarded with inflammatory foods, refined sugars, processed oils, artificial additives. Curcumin helps calm the body's immune system, reduce liver stress, and lower glucose levels. In clinical trials, curcumin supplementation has shown reductions in fasting glucose, A1C, and even triglycerides. It also supports liver function, which is critical for glucose storage and conversion. However, turmeric must be taken with black pepper extract, Berberine, to be absorbed effectively. Without it, bioavailability is extremely low. Standard curcumin with Berberine supplements usually contain 500 to 1,000 milligrams per capsule and can be taken once or twice daily with meals. For people dealing with fatty liver, brain fog, and chronic pain, all common among diabetics in the United States, curcumin provides a multi-pronged support system that targets root causes, not just symptoms. These 11 supplements, when used strategically, have the power to transform blood sugar regulation, but only when paired with consistent use and awareness of your body's response. In the United States and other Western countries like the United Kingdom, Canada, and Australia, the diabetic crisis is largely lifestyle-driven, and while medications offer temporary control, they often don't reverse the problem. These nutrients and herbs, however, go deeper. They support insulin production, repair cellular damage, regulate inflammation, and restore nutrient balance, issues that are central to the diabetes epidemic but rarely addressed in traditional care. Many people are told that diabetes is progressive, but that's not always true. If you feel like you've tried everything and your blood sugar still won't improve, it might be time to rethink your entire approach and consider what your body actually needs at the root level. Supplements are not magic, but when used correctly, they offer an incredible opportunity for recovery.